affordable, which is the name of the law.
Yeah, and for people who have a plan, they have a doctor, it's not going to change it, right? That's what a lot of people fear, that you've heard it before. You're not going to be able to see your doctor anymore. You're not going to have the plan you like.
That's not true. That's not true. There are so many scams now that are flooding the media and advertising now. It's a real boondoggle for people who want to take advantage of older people. A lot of scams I'm seeing are targeting Medicare, which is not going to be negatively impacted by this at all. In fact, the Affordable Care Act fills up what is called the donut hole in Medicare Part D, which is the prescription drug plan that passed a few years ago. Now that gets filled. So the Affordable Care Act actually pays for the rest of the gap in prescription drugs for older people, for Medicare enrollees. So again, older people make out really well under the Affordable Care Act as well in terms of the donut hole. So don't believe the scams. If you hear my advice is if you hear scare tactics or if something sounds too good to be true, they're both bad. You know, this isn't free and it's not cheap, but it's a value-based plan. Think Walmart, think Target, think Nordstrom if you think Nordstrom brings you value. Think of how you define value, like Trader Joe's. This is that kind of plan. If you take politics out of it, there are many, many good things for many, many people who haven't had access to primary care, health care, or a list of drugs that they've needed to manage cholesterol, to manage diabetes, etc. So once we can get people taking care of themselves in this basic way, our costs will go down.
A lot of people also say, well, it sounds good, but why does the government have to force everybody into it? Why do we all have to be forced? And if you don't sign up, you're going to be fined. But as you explained, Jane, even if you're really poor, who can afford $2 a month?
Yeah, it depends. You have to use the calculator and calculate how much discount you're going to get. But the point is, we have to learn in America about risk management. You know, the risk of not having insurance in the next year. When you've got a kid with asthma, you've got to buy the inhaler every month. You've got to see the pediatrician a lot. The kid ends up in the ER. That could take 2 weeks of your pay. That's $1,400 when you think about it. So we all have to be honest about what risks we're facing. Do we have kids? Are the kids sick? Are we managing a chronic condition? And work on the back of a napkin and figure out how much you're really already spending at the pharmacy on special foods, going to a clinic, driving to a clinic that's really far because it might be cheaper, but you have to take off work for that. Here, if you have insurance, you can go to a local doctor, save the time, get back to work. Or take advantage through your employer of wellness programs that this law also incentivizes employers who are offering health insurance to offer more preventive services. These are for people who already have insurance. So Obamacare's got a lot of different goodies for different types of people. Not just the working poor, not just the poor, but even working middle-class people who are already insured. They get extra preventive services that are free under Obamacare. So no longer will I have to pay a copay for my mammogram, for example, which for some people paying a copay for some tests prevents them from getting the test. And again, if you don't get the test, you then are delaying the possible diagnosis of something that could be much worse in a couple of years down the road.
And how about the argument people will throw and say, well, it all sounds nice, even if it works to its most ideal, but it will bankrupt the country. It'll bring down the country economically. It's too expensive. We can't afford it.
Well, as I introduced our segment, I was talking about the fact we're already spending $1 in every 5 on health care in this country. What this law is actually doing is rationalizing that cost downward by putting people into care settings that are cheaper up front versus down the road. So the intention of the law is to evaluate what works, what's cheaper, deliver more quality in terms of outcomes, which again, the more quality, we learn that the higher the quality of healthcare, the cheaper it really is. It's the crappy healthcare that costs more in terms of complications, having to return to the hospital, you know what I mean, redo the operation. That's what costs. The well-oiled machine is cheaper. So that's what this law is really trying to do in terms of learning what works, what doesn't. And what's actually helping us do that is another government program, which is the one where doctors have financial incentives for adopting electronic health records. Some people are starting to see their doctors using computers now in the office. And that's a very good thing, too, because you can't manage what you can't measure. So now that people will have their medical records electronic, which is very much related to this law. This law is about doing what's effective and not paying for what doesn't work. Ultimately, that's where the Affordable Care Act means to go. So we can't afford not to do something. This is the best thing they could get done a few years ago. It ain't perfect by any means, but we have to start getting real about the fact that we are broke in this country and that other countries like Germany, Japan, China do not fund health insurance through employers or the workplace. So our companies here are at a competitive disadvantage because they pay for health care. So on the global stage, I'm from Detroit, so I'm sensitive to this. GM, one of the reasons they went through their financial disaster is they had to pay for the health care of retirees that they promised to do under union negotiations. Toyota, Honda, Kia, they don't do that. They don't have to do that. So health care in this country, as I introduced our time together, is an integral part of the economy, and we really have to get real about this. No, legislation is never perfect. You can't show me one bill that everybody has loved, but we have to start somewhere, and we can tinker with this in a year, in 2 years, but after we taste the Kool-Aid, see how it goes.